Madam President, I rise today on behalf of the 30,000 military families who have loved ones with disabilities, including those on the autism spectrum. Sadly, thousands of these Americans suffering from autism and other developmental disabilities are not receiving the treatment that the best practices has determined that they need. For example, military families with children on the autistic spectrum are receiving fewer services than their civilian governmental counterparts across the country, many of whom have been rightfully aided by laws passed in over 60% of our states, representing over 75% of the American population. Autism places such tremendous strain on our families, health strains, financial, emotional strains. They take such tolls. I want to share with you briefly just a couple of the stories we've heard from military families that are struggling, that have done everything we've asked of them as a nation, but now can't even provide for their children. One veteran who was severely wounded in Iraq while heroically serving his country, his injuries were such that he was forced to retire. Because he's retired, his autistic son, Shane, was no longer able to receive the applied behavioral therapies that were recommended. The wait list for the Medicaid waiver services where he lived was 9 years. So Shane's family had to sell their home to pay the roughly $5,000 per month of out-of-pocket for the ABA treatment he so desperately needs. Now, the money is running out for their family, and they don't know what to do, but they want to do what's best for their son. Without this relief, we risk allowing brave military families just like this one to fall through the cracks. Another story, a Marine on active duty serving in Iraq and Afghanistan 3 times has maxed out all his ABA therapies to treat his 11-year-old autistic son, Joshua. Now, Joshua is nonverbal, and his safety is a key concern for his family. So Joshua is prescribed 35 hours of ABA therapy per week. Because of the severity of Joshua's symptoms, the family's basically faced with the impossible decision of either foregoing the recommended care that the doctors prescribe for their son or paying these bills out of pocket for as long as they're actually able. I don't believe this should ever happen to our military families. I don't believe it should happen to any child. And that's why I'm introducing my amendment requiring TRICARE to cover the recommended ABA therapies that a doctor prescribes. It would be a manner that is consistent with the best practices across this country and in the rest of the federal government. Our children need this kind of support. Shane and Joshua need this kind of support, and we should be standing by our men and women who serve in the military because they stand by us. Every parent who has a child with autism or another disability faces challenges to ensure that their child has access to the treatments that they require. For these military families, the challenges are even greater and often compounded by the frequent deployments overseas, the frequent moves to different bases across state lines, and sometimes significant gaps in their coverage. Today, TRICARE coverage of ABA is severely limited. It's capped. It's capped at $36,000 a year per active duty member, which falls far below what is medically recommended for so many of these children. This care is limited to active duty service members only, and Guard and Reserve families receive intermittent care, and children of retirees can't even get coverage at all. As a consequence, military service members often must turn to the state Medicaid programs to help provide these services to their kids. But the problem is these services are often unavailable because of long wait lists, years. In Maryland, for example, the wait list is 7 years, essentially eliminating ABA coverage during the early developmental years that a child needs it most. The wait list in Virginia is 10 years long. Even more remarkable than TRICARE not covering these treatments is that the Office of Personnel and Management has determined that such treatments may be covered as medical therapies for federal civilian employees. A recent court decision, which the DoD is still reviewing and may appeal, determined that TRICARE must cover these treatments. But this decision is being applied under the most narrow definition in the interim, limiting the potential pool of providers. This amendment requires TRICARE provide coverage and deliver services in a manner that is consistent with the best practices, thereby improving access to care for our military families and aligning the TRICARE policy with coverage that's basically available to anybody else in the civilian sector. I believe we have a duty to stand by our military families. We have to address this difficult medical issue. We ask so much of our men and women that serve in the military. We must support their families. This amendment simply fulfills that promise. I yield the floor to my colleague.
Madam President.
Senator from Oklahoma.
First of all, I want to state from the outset, I agree with the assessment of the senator from New York in terms of the treatment that should be offered. I have no problems with that. I think she's right. There's a lot of other things in TRICARE that aren't right. And what the senator from New York is doing is admirable. But there's a portion of it that's not. With the modification to her amendment, she has now raised the total cost of this amendment over the next 10 years to $1.9 billion. And it is true that she has managed to insert with some excess funds that will be spent before the end of the year, that won't be there by the time the money for this is used, to pay for it. So she does meet that standard. But she doesn't meet the standard for the next 10 years. And so we're in the midst of this large discussion about how we're going to get out of the fiscal mess. And I take her at a word. She really does want to reform TRICARE and fix it. But do you realize TRICARE hadn't had a premium increase since 1995? And all it would take to pay for this is a $2 per month increase in premiums for those on TRICARE. And it's just TRICARE Prime. It's not TRICARE Standard, and it's not TRICARE for Life. $2. $550 a year covers your whole family with no deductibles and no copays right now. Hadn't been increased since 1995. So one of the things we ought to do is we ought to work to bring TRICARE standards up to make sure they meet the needs of everybody. I don't disagree with that. But the other thing we ought to do is we ought to pay for it. Now, where's the money going to come from to pay for this very well-intentioned and proper thing? The way it's written now by the senator of New York, this will come out of the Operations and Maintenance Fund. So the very father of an autistic child will have less flight time, less drill time, less shooting time, less preparation time to go out and be a warfighter. And as we think about the 10% across the board cut that's coming, or the $500 billion that's proposed to come out of the Defense Department over the next 5 years, none of it's going to come out of TRICARE. So what we ought to do is we ought to fix these things, but we ought to fix them without digging our hole deeper. Secretary Gates, before he left, he said the biggest thing that's eating the lunch in the Defense Department is the Department of Health within it that manages the health things. Because we've not done an appropriate job of having some slight rise in premiums to cover some of the tremendous benefits. Nobody else in the country gets the benefits that we give with TRICARE. Nobody. $550 a year for family, $275 if you're single, and no copay and no deductible. And all it would take is $24 a year by our TRICARE Prime to pay to make sure that the people with disabilities and the people with autism have the appropriate therapies and they're covered under TRICARE. So one of the things that I would ask my colleague from New York if she would mind withdrawing her amendment to be voted on later, that I might be able to offer a second-degree amendment and maybe that way or another way pay for this out of things that we know that are going on, that we could find $1.9 billion over the next 10 years to actually pay for the cost of this over the next 10 years. We didn't have time to do that beforehand. I don't know if she'll be willing to do that. But there's no way you should justify taking another $1.9 billion out of the operation and maintenance program for our troops onto health care. We ought to eliminate something that doesn't take away from their training time, flying time, shooting time, or sailing time. We ought to be taking it from somewhere else. But that's where this is going to come from. And so I applaud what she's doing. She's right about fixing the problem. She's totally opposite of what we should be doing in terms of paying for it. And I would offer to work in good faith in the next hour to try to come up with a second-degree amendment that would be acceptable to my colleague and to the ranking and chairman of this committee that would actually pay for it. So with that, I yield the floor and reserve the balance of my time.
Five minutes for Senator Coburn and 6 minutes for Senator Gillibrand. Gillibrand are remaining.
Will Senator yield me 2 minutes?
I'd be happy to yield.
Madam President, there's no one that I know of in this body at any time that would not want to assist and provide the best care for our especially disabled children who have autism. It's one of the most compelling stories that any of us have ever seen. But I think it's also important for us to recognize that when we continue to add on benefits without a hearing, without any scrutiny, without balancing where it is in the array of priorities that we have, and without paying for it, it seems to me that in the budget that we have and the expenditures that we have, to just say, as the distinguished senator from New York just stated, well, we'll address it next year. We'll get that taken care of. Well, we all know what the hardest thing around here is to find funds for programs. So I appreciate more than I can say the dedication of the senator from New York on this issue. But here we go again. We're going to now bestow another entitlement which is not paid for. Now, in all due respect, I say to the senator from New York, why don't you give us something to pay for it with? Why don't you come up with an offset that would then not have us increase the debt by, I asked my friend from Oklahoma, $1.9 billion. We're now adding a cost of $1.9 billion in the name of one of the most humane and compelling causes that any of us know. But don't we have an obligation to the taxpayers? We have an obligation to the taxpayers here to say, we're going to take care of these special needs Americans, but we're going to pay for it. Instead, we're going to lay an additional burden on the taxpayers of America, which someday is going to have to be paid for. Someday. May not be in this bill, but someday it's going to have to be paid for. So I'd like to see the senator from New York. Obviously, this amendment is going to pass, but I would love to see the senator from New York tell us how we're going to pay for it. I don't think that's an outrageous demand. I yield.
Well, I want to thank
Senator from New York.
I want to thank my colleagues for their statements of support for meeting the needs of the children that do suffer from autism and other developmental disorders. And I do appreciate and believe their sincerity in wanting to make sure they are covered with the treatments that they need. I think that we can work together to reform the TRICARE system. It's one that has not had the kind of reform that it needs. But this is just an authorization for 1 year to meet the needs of these kids now, because I don't want to wait till we figure it out and figure out the rest of the program. In addition, we did have a hearing. We had scientists and doctors and those who are medical professionals come to testify in front of the Armed Services Subcommittee. Through that testimony, we established that the only reason why the DoD wasn't covering this was because they believed it was an educational program. And what we established and what the medical literature says, it's actually a medically necessary treatment in the same way you'd give a child who's sick a medicine. And so I want to address the needs of these kids now. I will commit to working with you to reforming TRICARE so we can actually pay for programs over the long term and reform it in a way that's consistent with the benefits that our troops so desperately need.
Madam President, might I ask through the chair, the senator from New York, if she would consider for a short period of time of withdrawing her amendment and allowing me to develop a second-degree amendment that would actually pay for this so that both we would accomplish her goal of, and I think all of our goal of making sure the proper treatment's there, but won't handicap the armed services in terms of delayed training, less flight time, because it's going to come out of the operation and maintenance budget. And I would wonder if she would do that with the assurance of the chair, with the assurance of the ranking and chairman of the committee that your amendment would still be considered.
I would urge my Madam President, I would
Senator
urge
from
my
New York.
colleague to take a more lengthy time to consider how to reform TRICARE and pay for this program than just an hour or two. I would like to pass this amendment now. Right now, Operation and Maintenance has $174 billion a year in it. This is $45 million for 1 year just to get the treatments in place for these families. In a 1 year's time, we will have more accountability and transparency on what the real cost is. This is just an estimate. So what we want to do is be able to have more facts and then go to reform the TRICARE system properly. And I commit to you, I will work with you on that. This is only authorized for 1 year.
Madam President,
Senator from Arizona.
I believe it was Ronald Reagan that said the closest thing to eternal life here on earth is a government program. Again, our complaints that we continue to hear from our constituents is that we've mortgaged our children and our grandchildren's futures. And to somehow say, well, we're only authorizing this program for 1 year, does the senator from New York really believe that once we start treating children with autism, that we are going to terminate that program? Does she really believe that? Of course not. Of course not. We have an obligation to the men and women of this, the citizens of this country that we have saddled with a $16 trillion debt, that we pay, we find ways to pay and sacrifice ourselves physically to pay for worthwhile programs. So I would support a second-degree amendment from the senator from Oklahoma, which is his right. It's his right to do so. And I don't see how we fulfill our obligation to our citizens by continuing to authorize and appropriate expenditure of their tax dollars without a way to pay for it, except to take it out of our taxpayers' pockets. That's not right. That's not right. And the senator from New York knows it's not right. For us to, no matter how worthy the cause, for us to continue this continued spend, debt that the American people are saddled with. Because we are now, I probably won't be paying for the national debt, but my kids will, my grandkids will. And can't we at once say, look, this is a worthwhile program, we all support taking care of people with autism, and here's how we're going to pay for it. That would be a unique experience around this body. I yield.